Good morning, it's May 27th, and this is To My Liberal Friends. And I'm sure we can all remember the story about Chicken Little. While walking through the barnyard, an acorn falls and hits her on the head. She panics and begins screaming, "The sky is falling, the sky is falling." Other animals heard her, and she convinced them that the sky was falling. The result was mass hysteria. The ducks, the geese, and the turkeys all panicked and started running looking for shelter. In the story, the fox sees them running, and he offers a safe haven by putting them in a big room in the cellar, and then he shuts the door. Of course, this is a children's story, so we don't say what happened to them, and when queried, the fox just said they're a pack of silly fowls anyway. The story is being played out again by Democrats when they talk about the so-called cuts to Medicaid. The moral of the Chicken Little story is to check your sources and think critically before believing for spreading information that in the end turns out to be false. The Democrats are running around telling people the sky is falling and Republicans want to end Medicaid. They claim that millions of people will lose access to health care. Now, according to House Democratic leader Hakeem Jeffries, this is, quote, a matter of life and death. His source of information is a study from the National Bureau of Economic Research that purports to say the Obamacare Medicaid expansion reduced mortality among low-income adults by 2.5%. The study maintained mortality. It examined it from 2010 to 2022 for working-age adults with incomes below 138% of the poverty line in 2009. This is the population that gained eligibility under Obamacare expansion, though many later obtained private coverage when their incomes rose and they were no longer eligible for Medicaid. The problem is the study has some serious flaws. The 2.5% difference in mortality for low-income adults between expansion and non-expansion states wasn't statistically significant when disabled adults were included. But by including this key component, the study was able to arrive at the conclusions they wanted and basically tell us the narrative that they wanted for the outcome. What's clear is that Obamacare expansion hasn't reduced deaths among lower-income, able-bodied adults. U.S. life expectancy remains about the same as it was in 2014, owing largely to increased deaths among such adults from drug overdoses and chronic disease. A study last year in the Journal of American Medical Association found that working-age adults on Medicaid were about 3 times more likely to die from drug overdoses in 2020 than those not on Medicaid. While the disparity no longer doubts or reflects socioeconomic differences, it also shows the program does a poor job of preventing and treating substance abuse within this population. Now, here are some facts that Democrats don't want to talk about. Accountants at HHS have said that between 2017 and 2024, the current budget cycle, that between $540 billion and $1.1 trillion overpayments were made in the Medicaid program. The current House bill seeks to cut $700 billion over a 10-year budget cycle. That means about $70 billion per year, and if the department is aggressive in cleaning up the overpayments, that more than covers it. The second part of the bill that Democrats won't talk about is the requirement that able-bodied adults perform some form of work, 20 hours a week, to remain on the program. That includes looking for work, volunteer work, or some educational program that might lead to a job. And reading the polling on this question, we find that 73% of voters believe there should be some form of work requirement. But Democrats object to this, and when states like Arkansas and Georgia tried to implement them, the Biden administration turned them down and tried to shut them down. Now, one of the problems with Medicaid is the states have figured out how to game the system. Under federal law, states can levy taxes on managed care organizations known as MCOs. They structure them so that they only serve Medicaid patients. They allow the MCOs to charge higher rates, thus allow the states to receive higher amounts of funds from the federal government. It's sort of a vicious circle. The Trump administration has a plan to stop this chicanery, and it would ban states from taxing Medicaid businesses, these MCOs, at higher rates than non-Medicaid businesses. This would stop states from gaming the system. The bottom line is that Medicaid needs to be reformed. In its 60 years, Medicaid has swelled from a small program that provided medical care to poor Americans receiving some form of government assistance to the largest source of public insurance. It covers over 72 million Americans, which is about 1/5 of the population. This represents an increase of 18% from 2020 to 2023, the last figures available. In states like California, it has provided their version of Medicaid to illegal immigrants, causing a massive shortfall in the budget. Even a liberal governor like Gavin Newsom has said this has to stop. The reforms in the bill passed by the House are just a step in the right direction. More needs to be done. So when you hear Democrats decrying these changes, remember the story of Chicken Little. The sky is not falling, and they're trying to panic the general public without any real facts. This has been To My Liberal Friends. Thanks for listening.